For our final presentation, allow me to introduce you to De-Andrea Blaylock-Solar. De-Andrea is Missouri's first Black AASCCT certified sex therapist. She has worked in behavioral health for more than 15 years and sees herself as a catalyst for positive change, serving as a collaborator and co-facilitator in healing. She enjoys the journey of working with her patients. Now, I'll turn it over to De-Andrea.
Hi, everyone. Thank you so much for having me. Thank you, Allie, for inviting me to be here. And I'm excited to talk about sex, really talking about what sex can look like after dealing with prostate cancer. So my name is De-Andrea Blaylock-Solar. I am a licensed clinical social worker and a certified sex therapist. I'm based in St. Louis, Missouri. And I have a private practice called Sankofa Sex Therapy, where I work with individuals and those in all types of relationships. Another area of specialty that I have is that I hold space for folks to kind of dismantle some bad theology they may have encountered throughout their lives so that they can have good and fulfilling sex. Also, a couple of fun things. I've completed an off-Broadway run of a show called Antigone and Ferguson, where I was able to serve as a member of the chorus, as well as moderating discussions after every performance. And I am a member of the leadership collective of the Women of Color Sexual Health Network. And I've been a part of that organization since 2011, serving on the leadership collective since about 2012. So I have been a licensed clinical social worker for many, many years, but serving as a sex therapist specifically since 2011. So I've been in the field for a little bit, and I'm happy to bring my expertise here to talk with you all about what sex can be after prostate cancer. So, our first question here, why is it important to talk about sexuality after cancer? I think it's so important to express your sexual concerns because there is a really high probability that your expression of sexuality may be impacted by cancer. Unfortunately, a lot of our providers aren't always as forthcoming about what may occur after treatment. So, you as the patient may have to be in the space of initiating those conversations. And, like the slide says, opening up about your sexual concerns really will help you navigate any bodily changes that you may experience, and it can improve your relationship with others as well as yourself. And I think that's something important to think about, whether you're partnered or not. It's important to be really clear about what sexual functioning may look like after your cancer diagnosis or after treatment. So when when you hear the word sexuality, I want you to take a few seconds to think about what comes to mind. Um, just notice what thoughts, feelings, and emotions arise as you think about this word, because as a concept, it's pretty broad. Sexuality can be so much more than just the physical act of sex, or how you may have previously defined what that physical act can be. And like the definition that's provided here, human sexuality is the way people experience and express themselves sexually. This involves biological, psychological, physical, erotic, emotional, social, or spiritual feelings and behaviors. Because it's such a broad term, which has varied with historical contexts over time, it's really hard to pinpoint a precise definition. And so, because of that, I have something here that's called the circles of sexuality. This is a model that was created by Dr. Dennis Daly. I do have him cited at the bottom here. And we have these various aspects of our sexuality: sensuality, intimacy, sexual identity, sexual health and reproduction, and sexualization. But in the center here, we have values. And that's because all these various aspects of our sexuality are influenced by our estimations of what's important in our life. What do we find important? What do we assign value to? All of that it affects these various areas. So I want to go into each area specifically just to break it down. So first we have sensuality. And sensuality is awareness and feeling about your own body and other people's bodies, especially the body of a sexual partner. Sensuality enables us to be aware how our bodies look and feel and what they can do. Sensuality also allows us to enjoy the pleasure that our bodies can give us and others. And this part of sexuality, um, it 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 can affect our body image. It can also affect the way we experience pleasure. This idea of satisfying skin hunger, feeling physical attraction for another person, and fantasy. And when I think of sensuality, I really like to think of it as the way in which we are able to experience the world through our five senses. If you got a sixth one, that one as well. But just thinking about how do you experience the world through sight, touch, taste, smell, and sound. That's really what sensuality can be. It can be sexual, but it doesn't necessarily have to be. Next, we have intimacy. And intimacy is the ability to be emotionally close to another human being. Um, and the ability to accept that closeness in return. It does not have to be sexual since there are so many different types of intimacy. And some aspects of intimacy include sharing, caring, liking or loving another person, emotional risk taking, as well as this idea of vulnerability. And vulnerability is something I often say that vulnerability is scary just because you are really being bare in front of someone. And as you're dealing with sex, specifically after cancer, it is important to find spaces where you can feel safe enough to be vulnerable, to ask those questions, and also to get the things that you want as it relates to intimacy. As the slide says, intimacy is the degree to which we express and have a need for closeness with another person. Its components are caring, sharing, liking, loving, trust, vulnerability, self-disclosure, and that idea of emotional risk taking. Next, we have sexualization. And this is the aspect of sexuality in which people behave sexually to influence, manipulate, or control other people. It may be thought of as the shadowy side of human sexuality, but sexualization spans behaviors that range from the relatively harmless to the sadistically violent, cruel, and criminal. These sexual behaviors include flirting, seduction, withholding sex from a partner to punish them or to get something, sexual harassment, sexual abuse, and rape. It addresses the fact that no one has the right to exploit you sexually, and you don't have the right to exploit anyone else sexually. Um, and the slide here really just gives a summary of that idea of how it includes this idea of manipulation, but the other side of that is that it includes flirtation or seduction, which doesn't have to be from a place of harm. The next two aspects of the circles of sexuality here are sexual health and reproduction and sexual identity. Sexual health and reproduction, it really relates to the attitudes and the ideas and behaviors toward your own health and the various consequences of that sexual activity. Its components are behavior, anatomy, and physiology. sexually transmitted infections, contraception, and abortion. I have here spontaneous or induced. All of that is what's included in sexual health and reproduction. And as you are recovering or living with cancer, it's important to think about this aspect with the circles of sexuality, how this can definitely influence how you think about yourself and how you think about your own sexual functioning. Next, we have the sexual identity aspect. And sexual identity is a person's understanding of who they are sexually, including the sense of gender identity. And sexual identity consists of three different pieces, which talk about gender identity, expressed gender roles, and sexual orientation. And thinking about how this may be affected by living with cancer, if you do identify part of your expression of gender through your sexual expression, and that changes, that may then shift this aspect of the circles of sexuality as it relates to sexual identity. So I want to talk a little bit about some common experiences after treatment, different things that may occur that your doctors may or may not talk with you about. And I'm going to list through them and talk about what they are. And just because they're listed here does not mean that they will occur, but it's a possibility. And also, there are some other experiences that you may experience that aren't listed here. So this list is not comprehensive, but it just gives an idea of some things that may occur. So the first thing is incontinence, and that's the inability to manage or control your bladder, or and that could be urinary incontinence or not, but that's something that could occur. Also, a change in your desire for sex, and that could be related to physical functioning as well as other psychological factors. Just thinking about everything that you're going through that may then put your desire lower on your priority list. Also, another thing that may occur is penile curvature. If there are different treatments that you may experience, it could cause a curve in the penis. And that's just something to talk with your doctor about and talk with partners about as well. Also, pain with sex is something that could occur. Additionally, we have this idea of retrograde orgasm, and that's something that's also referred to as dry orgasm. It's where someone with the penis may have an orgasm, but instead of ejaculate coming from the penis, it kind of retrogrades back into the bladder, and that is just something that's common that can occur. And there's various ways to deal with that. Also, these last things that I have listed here, I'll spend a little bit more time talking about. This idea of depression, anxiety, and grief. I think that a lot of times when we think about grief, we only think about it in the context of losing someone, whether that's a friend or a partner or a family member. But we don't often make space to grieve the loss of bodily functioning. You may be used to, like I said, some people may like strongly identify with their prowess in the bedroom. And then when that functioning is lost, it's almost like you're losing a part of who you are. And so you're having to, in addition to dealing with this diagnosis, dealing with bodily changes, you also have to think about this idea of sexual identity that I mentioned before, how it may kind of flip your world upside down, and it's important to make and hold space for that grief because it's something that is not often talked about. And with that, the idea of depression and anxiety, and that kind of goes hand in hand with this idea of low desire, where the ideas that you may have about yourself may change. and trying to figure out different ways of how to redefine yourself outside of uh, your sexual identity, or maybe even inclusive of it, but understanding how important it is to hold space for these different things that may occur. Also, with anxiety, you may experience challenges with erection or erectile difficulties in situations where you may feel a certain pressure, whether that's external or internal, but a certain pressure to perform. And that pressure can then make you feel anxious, where you feel those physical symptoms of increased heart rate, or your hands may shake, or various physical manifestations of anxiety, in addition to the thought racing and things of that nature. Also, there's a word called spectatoring. And if you think about a spectator sport, it's where you sit in stands and watch the people do whatever sport it is. I'm thinking like watching a tennis match or watching a football game. And sometimes what happens is when people do experience anxiety around sex, they may do something called spectatoring, where they're no longer physically in their bodies experiencing pleasure, but they're kind of in their heads just thinking about, oh, I'm wondering if I'm doing this correctly. What is my partner thinking? Oh, it's taking me longer to become erect than before. I'm not staying erect as long as I used to. All of these different ideas that may be going in your head that make it really challenging for you to stay in your body and experience pleasure. That's something called spectatoring that I didn't have it on the slide, but it's still related to this idea of anxiety that you may be experiencing around sex, as well as grief. Just making sure that we are holding space for this loss of functioning, and how it may impact how you view yourself. And so I don't want us to think that it's all gloom and doom, even if we are dealing with these various challenges. There are a lot of different options available. Um, Even though, all of these previous items seem quite overwhelming, especially when you're hearing them from a provider who does not provide a lot of guidance. So what can we do? How can these effects be treated, and what options do we have available? So, like the slide says, it's important to make sure that we have good communication between ourselves and our treatment team so we can figure out different treatments that are available. First, here is pelvic floor physical therapy, and that is an amazing intervention that can help in a lot of different ways. Also, there are various oral medications that people can take. If you are experiencing erectile difficulties, then there are the PDE5 inhibitors, the little blue pills, whether that's Levitra, Cialis, etc. If it is healthy enough for you to take those medications, then that can be an intervention you can speak with your providers about. Also, there are various devices and implants that are available, various penis pumps, as well as insertable devices that can be surgically implanted if that's an option for you. There are also different types of injections that can be used that can assist with erectile difficulty, and topical treatments as well. I want to pause to say I know that there are various things that people may buy at the gas station. I can't remember specific, like honey packs, or different things like that. And when you are under the care of a physician for various other issues such as cancer, I would strongly suggest that you speak with your provider before using those other interventions, just because you don't want it to negatively impact the treatment that you're experiencing, and you don't want to have any unnecessary medical issues. So, If you see those, I know they're easily available. However, because they're not regulated, it may be challenging to initially figure out how it will interact with the medications that you're currently taking. So you'll want to make sure that you speak with your treatment team before using those things. All right. And last but definitely not least, psychotherapy. And you want to work with a qualified counselor who is knowledgeable about sex and sexuality. So I'm a certified sex therapist, certified through the American Association of Sexuality Educators, Counselors, and Therapists. And we are an organization that certifies counselors, educators, and therapists to work with individuals. So, a therapist does not have to be AASECT certified to be a good person to work with. However, if you are wanting to talk with someone specifically about sexual dysfunction, then it may be helpful to find a specific certified sex therapist or someone who does have additional training in sexuality so they can be appropriately helpful for you. There is a provider locator on the AASECT website, and that website is aasect.org. That's asect.org. And there is a provider locator where you can search for one according to your state. And with that, I thank you for your time and your attention. And I am available for any questions that you have. And if you feel uncomfortable with asking your question out loud, then you can definitely email me and I'll answer those questions at a later time. But my information is listed here. You can reach me at sankofasextherapy@gmail.com. And my website is sankofasextherapy.com. And if you're on Instagram, Twitter, X, or Threads, you can find me at Sankofa Sex. All right. Thank you very much for having me.